So Remdesivir has already been given to patients in Australia, both earlier on in the pandemic and in recent weeks in Victoria. So that drug is available. That's good news for people who are suffering from moderate to severe coronavirus disease. But what I would say is that the real advantage, of course, that people have suffering from coronavirus disease in Australia who do get unwell is our expert intensive care doctors and nurses. And really, we have amongst the world's leading intensivists, the world's leading critical care nurses. We have worked to bolster their capacity through the provision of extra ventilators, through extra beds and through upskilling over 20,000 registered nurses in aspects of critical care medicine in order to prepare for any necessary surge capacity for intensive care. Given that there are only 16 patients to the latest count who are in intensive care Australia-wide, we are well within that capacity. And it is the supportive care largely, rather than the drugs. It is the expert care, the expert management of a ventilated patient, the expert management of giving them intravenous fluids and drugs to improve their blood pressure, the administration of dialysis. These are the things that our Australian intensive care doctors and nurses are world experts at. There's not a week goes by that I don't speak to the President of ANZICS, Anthony Holly, to get updates on the intensive care situation in Australia, to Professor David Pilcher and others down in Victoria, Dr Steve McLaughlin. These are the people that I speak to that reassure me that Australia has the necessary intensive care capacity. So whilst Remdesivir is certainly good news, the best thing that we have in Australia is our skilled doctors and nurses. And I'll take questions. So, like anything in the COVID-19 pandemic, we need to be cautious about our supply lines. We've been working very collaboratively with Gilead, and I'd like to thank them for their collaboration with the Australian government. The current supply within the national stockpile is a donated supply from Gilead. In light of what's going on in Victoria, we will seek to procure more Remdesivir from Gilead, and whilst we have comfort in those supply lines, I think one of the things we learnt from February and March is that we're not 100% confident until things arrive on our shores.
Treated with the stockpile that we currently have in Australia?
So we're satisfied that the current stockpile in Australia will be enough for the coming weeks based on the numbers in Victoria at the moment.
What are you expecting then in the coming weeks? Because Victoria has seen increases in case numbers over the last week or so, 216 today. What's the data looking like in terms of the number of people who could be hospitalised down in Victoria in particular?
Well, I think the important thing is that we've now introduced a number of measures in the past week that we know are very effective in reducing the numbers of coronavirus disease. So that's the first thing to say. The restriction in mixing, the restriction in people gathering, the stage 3 restrictions themselves are intended to decrease the numbers. And what we're likely to see is, as Professor Sutton has said, potentially increased numbers in the coming days, but we will eventually see a plateau. We know that this works. It's worked where there have been second peaks worldwide. It will work in Australia. In terms of the actual numbers that we're seeing, they're actually a little bit less than we saw in February and March in terms of the hospitalisations and the intensive care admissions. Why is that? It's because the demographic of this current epidemic has changed. We're talking about younger patients, and whilst that produces less hospitalisations, that is by no means a caution to young people and young adults out there that they should ignore coronavirus disease. There have certainly been cases of severe COVID-19 leading to death amongst young people. It's just that that particular severity of disease is more common in elderly Australians. So we're comfortable with the current, we're very comfortable with current capacity down in Victoria at the moment. And obviously it's good that only 16 patients are sitting in ICUs at the moment.
Remdesivir is, from what we can see online, a fairly costly drug. When it's prescribed, who's supposed to foot the bill for that? And also, why has Gilead donated this stockpile to Australia? Do you have
So in terms of the cost, whilst it is a relatively costly drug. There are cancer and chemotherapeutic agents out there that are many-fold more expensive that we supply through the MBS. So there's certainly no exception here. This will be paid for by the Australian government. The donation was particularly generous from Gilead in the early phases. Gilead's done a number of things as I guess as a corporate citizen. Probably the most notable is to look at generic manufacture of this drug for the developing world. That's other pharmaceutical companies that will be able to do that. We need to procure from Gilead.
Just ask you about the cases we've seen in Sydney in the last 24 to 48 hours. We've seen spikes at hotels and other parts, particularly from people travelling outside of Victoria when they shouldn't have been. How concerning is what we're seeing in Sydney now? And is that a consideration that the AHPPC might need to take about further steps that might need to be taken in New South Wales?
So we're meeting daily. Even on the weekend, we had a meeting at Saturday earlier today. Obviously those two cases at the pub in Casula in Sydney's southwest are of concern. Those two cases are likely to be linked to the pub in question. It's a timely reminder that COVID-19 spreads in situations of close contact. And whilst we're aware that the pub had a COVID-safe plan, I don't have the specific details of how that virus has gone from one person to another, and that's something that New South Wales Health is investigating. What they do in that situation is look for upstream contacts, so people who could potentially have given it to those two individuals, and that's going to be the key here. If we're able to find that upstream contact, we'll be able to determine whether it was related to Melbourne travel or not. I think the New South Wales Health Minister and the Premier have made some very clear statements about their preference for Victorians travelling in New South Wales during school holidays. That is an understandable position to take as a protective measure for the people of New South Wales, remembering that this is a shared problem. Whilst we can think of ourselves as Victorians or Canberrans or New South Welsh, it's not really the case. This is a national problem, and so we need to deal with it with those national solutions.